Okay, so let's go ahead and jump in. I know we have a lot to cover and a really wonderful, rich set of panelists here with us this afternoon. So first and foremost, thank you all so much for being here, and thank you to our esteemed panel. We look forward to hearing what you have to share. Please advance the slide. All right, so just as a very brief point of introduction, my name is Qadria Ali, and I'm the co-chair of the Health Equity Achieved Through Lifestyle Initiative here at ACLM, and I am joined by my colleague, Dr. Bascom.
Welcome, everyone. We're so excited to have you here.
So next slide, please. So just as a little bit of level set, as you all know, today's webinar is really focused at the pillar of lifestyle medicine, physical activity. I know we put a lot of attention and I think a spotlight on the importance of nutrition as the foundation of the lifestyle medicine, I think, intervention world. However, physical activity we know has just tremendous benefits from head to toe, from our physical to mental health, even to that arm in terms of social connection. What we also know is that as a nation and even globally, there are significant gaps, right, in terms of individuals' ability to meet the physical activity guidelines, not to mention the strength training recommendations. And so we, within those gaps, we know that there are additional disparities based on where you live and what you look like and what communities you happen to be tapped into. And so the goal of today's session really is to look at the pillar of physical activity and specifically look at some creative approaches to ensuring that as many folks possible are able to tap into the joy and the benefit of physical activity, no matter where they are. And fortunately, we have really wonderful models to demonstrate what that can look like in practice and give us some ideas of, as lifestyle medicine practitioners, how do we bridge that gap between clinic and community with the goal of strengthening physical activity in communities that support it. Next slide, please. So along those lines, our learning objectives today are threefold, really to look at some of the common barriers to physical activity and what some of the health implications are of not meeting the recommended goals in terms of physical activity. And also, I think, shining a spotlight on some of the structural barriers that are very real that present challenges. Next, we want to spend some time looking at the components of various organizations and programs that are really leading the way in building community and really fostering this culture around fitness and physical activity using a health equity lens. And then we will end by talking about some strategies to strengthen collaboration, but really between clinic and community. And we will definitely have plenty of space for questions all along. We do have a dedicated Q&A towards the end of the session, but please feel free to put your questions in the chat and in the Q&A box specifically, and then we will draw from those at the end. All right, next slide, please. So we would love now to shift into introducing our panelists. So we're going to be very brief because I want to make sure we leave time for our panelists to really showcase what they do. So first up, we have Miss Adhana McCarthy, who joins us from really the Army and has a wealth of wonderful experience in terms of yoga and mindfulness. And so we really look forward to hearing what she has to share around her experience specifically with GirlTrek, which is a fantastic national organization that we're going to learn more about. Next, we have Miss Johnice. And Miss Didi, she is the Chief Program and Innovation Officer at Outdoor Afro, which is a national nonprofit organization that's committed to inspiring and connecting Black leaders in nature. So that's a little bit of a teaser, and we're going to hear more from Miss Didi shortly. And a quick plug, I'm an Outdoor Afro enthusiast here in the Washington, D.C. area, so very happy to have you on the panel. Next slide, and I'll let Dr. Bascom introduce our friends from St. Luke's.
I am honored to have the team from St. Luke's in Kansas City, Missouri, leading the Population Health Division for St. Luke's Healthcare System. We have Dr. Marsha Weaver, and joining her today are the Director of Population Health, Kristin Repp, and our community liaison from the Boys and Girls Club of Greater Kansas City, Darian Taylor. You're going to hear the amazing program that this team has developed that really is a great integration of clinical and community.
Daphne. Next slide, please. So in the next segment, we are going to be hearing from each of our panelists. We're going to have the St. Luke's team and Johnice and also Ms. Adhana share more about their individual work and why they are here today. So first up, we will have, looks like we have a little bit of a stutter with the slide. Has it advanced for, there we go. All right. Ms. Didi, you are up first, please, to share a bit about Outdoor Afro and your mission and your impact. So please take us away.
All right. Well, first, thank you for having me. So excited about this topic. Outdoor Afro, as Dr. Qadria said up top, is a mission-based organization, a national organization that is focused on inspiring, nurturing Black leadership in nature. And what that translates into is finding as many ways as we can to reconnect people to the land, wildlife, and water. And this is a way of not just, helping people get physically active, right? But it's a wellness connection as well. And we have a process there where we do our opening circles and our closing circles, which are very much about connecting to the other humans, building community, and also building intention about making sure that everyone gets what they need from their adventure outdoors with us. Next slide. We accomplish this work in great part due to our amazing volunteer network. We have volunteers in 62 markets in over 30 states and counting, because we actually have an open recruitment plug if anybody wants to join our amazing volunteer network. These are people who are members of their local communities, who are already leaders in some ways. Some of them are park rangers, some of them are teachers, but they also are nature enthusiasts. They're nature experts, from birders to rock climbers, hikers, folks who just get crazy over mushrooms. And the idea there is to attract the most diverse group of people that we can attract, right? Because, Black people are not a monolith, right? We love all kinds of things, and there are all kinds of ways that we incorporate nature and physical activity into our lifestyles. But these folks are also creating community, right? They become community pillars. They help us to understand what the community wants to do, the areas and spaces that are important to people. They help us create community that creates safe spaces so that people can go out and have that physical activity. The other things that we do, we have a Making Waves program. Our Making Waves program is specifically focused on water. When we originally started on that journey, it was about closing the gap between the disparity, rather, between the number of kids who are Black and drown, and right now they're up to 7 times more likely to drown than their white counterparts. And so originally it was, well, that's a crisis, and then it also is a legacy of segregation and this denial of access, right? Lack of proximity to public pools, fear of swimming in public waterways when you don't have the skill set. And so our Making Waves program, we give scholarships to remove at least the cost barrier. We've also partnered to remove transportation as a barrier and access to instructors and pools. So that program, also plug, if you or your child cannot swim, we want to pay for that. So please reach out to us for that. But also, you can't love water and you can't care about conserving or preserving water until you get over your fear and find your own love for it. And so that's a lot of what we do through both those programs. And we do that in great part through our partnerships with donors, other community organizations that we partner with liberally, and corporate partnerships, which help us to cover many of those costs and remove barriers and create access. And then the final piece that we do that makes, I think, us a little bit different too is the fact that we focus on civic education and also ensuring that our volunteers and our participants get training both in how to preserve and conserve, right? If you don't know who's responsible for a space, you won't know what to do when there's something wrong. And if that space that you love becomes unsafe, you won't get out there again and again. And we've got data to prove that folks who go out with us go out again and again, and they love it. And then we also give them a connection to it, a past and present connection, you know, to everyone who's walked this way before you, and why it's important to keep this going and to make getting outdoors and embracing nature, even if it's just for 2 hours a week, a part of your healthy lifestyle. Next slide. In terms of how we measure our impact, we are very strict in terms of our measuring the saving lives pieces, right? This is literally about how many people can we get in the pool, both the kiddos, but we also pay for the caregivers, right? Because who's diving in after that kiddo? And then who also is creating those outdoor adventures and special times? It's the caregiver. So we are measuring how many folks we get into the pool. In terms of building capacity, we are getting, Black community leaders certified in not just things like wilderness first aid, but also making sure that the recreation and the other kinds of activities they pursue, if there are certifications, we want to help remove the barriers to getting that expertise. And then we have found that those leaders bring it back into their communities, right? If they learn about foraging and safe foraging, if they learn about how to be safe in water, how to turn unsafe water into drinking water, they're going to bring it back to their communities. And they host at least one event a month, every month, to do that. And so we're measuring there the number of folks that we've gotten certified and on to dream roles and other things that they've had as goals. Launching leaders kind of speaks for itself. We have a whole volunteer leader core, but we also are finding that the folks who go to our events are telling us that they've started community projects, that they are advocating for pro-environment. They are getting out more and more with their families and recommending friends and family get out with them. And then finally, changing what it looks like to be a leader in nature, what it looks like to have a nature-filled lifestyle, and what it looks like to be active. It doesn't look the same for everyone. And so we are measuring their impressions. We are measuring their, literally do a Google search to see who is, the leader in fly casting. Do a Google search to see who is an expert in sailing. You're usually not going to get us, but soon you will. So that's a little bit about Outdoor Afro. Thank you for letting me share.
Thank you, thank you, thank you so much, Denise. Very concise but powerful overview of what you all do and why you do it, and the impact that you're making. I definitely have some questions I want to ask in the Q&A, so thank you so much for getting us started. Next up, next slide, please. We will transition into some contact info. This is for Outdoor Afro team. And then next slide, we have our St. Luke's team here. So I will pass the baton over to you all. Thank you.
Thanks, Qadria. Really appreciate the opportunity to share with you what we've been doing at St. Luke's Health System in Kansas City. A little different perspective from the health system angle. We're really focused on trying to improve the health of our community, both our patients and those members in our larger community around us. And so also want to give a little shout out to Dr. Bascom, because a lot of this was her brainchild when she worked at St. Luke's years ago, and we've been able to continue that work over time. So I'm going to turn it over to Kristin Repp, the Director of Population Health.
Thanks so much for having me here today. And yes, it's a really fun kind of full circle moment to be on the call with Dr. Daphne Bascom. We miss her. Okay, so this partnership is kind of unique and interesting, and it's been a partnership with pretty long standing now, 8 years that we've had this partnership. It really started out as, really trying to explore as a healthcare organization, how can we really collaborate with our community beyond just helping out when people are sick, right? We want to do healthcare, not just sick care. And so how can we start to promote health and wellness and truly anchor those strategies with an equity lens? The Boys and Girls Club population, if you're not familiar, they really do focus on some of the marginalized communities around the Kansas City area here, and St. Luke's is providing medical care to the same community. And so they're doing so much more than just providing out of school time care for patient or for their neighbors and these kiddos. They're really trying to empower youth and their families to really discover, their full strengths and to flourish as a community. So it made a lot of sense for us to partner with them if we're trying to move beyond just sick care and really look at healthcare. So the two kind of main priorities that we had when we started out here were providing healthy lifestyle information to other families, generating programs, all kinds of things. Anything under the healthy lifestyles umbrella can fit as a priority here. And then the other thing we were really trying to do is early introduction of career exploration for these family and these youth, to really introduce that concept that maybe some of these kiddos would like to be in the healthcare field someday when they grow up. So focusing in on specifically the physical activity stuff we're going to do for the rest of this presentation, but just to give a little how did we do this point, if other people on the call are trying to think through this, is we really tapped into our community benefit dollars as a non-for-profit healthcare organization. We look at our community needs assessments as part of Affordable Care Act and our CH&A CHIP process that people may be familiar with. And so we use some community benefit dollars to try and meet the need. And so we hired Darian as a full-time person. He's the second person to actually hold this role over this 8-year partnership. And he is a St. Luke's employee, but he is full-time embedded at the Boys and Girls Club all the time. So kind of a unique relationship. So if we go to the next slide, I'm going to talk about one of the programs and then turn it over to Darian to talk about what everyday life looks like and all the different physical activity programs we have. But this is the one that actually Daphne, Dr. Bascom, helped us launch while she was still here in the Kansas City area. And it's the REACH-IN program, which is an acronym that stands for Resilience, Education, Activity, Community, Health, and Nutrition. And so we did all kinds of things with this. We were typically partnering with the Boys and Girls Club to identify families that were interested in some of these same things. They wanted more nutrition education. They wanted to be a part of community. They wanted to increase their physical activity. So we held different sessions for different lengths of time at many of the different Boys and Girls Club locations and invited families to participate. We did everything from health screenings to, like I said, bringing in, I've got some fun pictures here in a second. We really tried to think out of the box here. We held some sessions at a roller skating rink, the Olarama, on one side of the city, which was really fun. We had a cohort at one of our universities, some other non-for-profit organizations that had food pantries or free dinners, things like that the community was already coming to. We were providing the programming there in those spaces as well. You can see there also churches and charter schools. So, I mean, just so many different partner organizations. The key here was that it couldn't be a one size fits all type of situation. We really looked to other partners who were doing this well, brought in speakers, really tried to listen to our community, take their feedback, and try and provide what people were looking for. So I've got some fun pictures on the next slide here. So on the left-hand side, that's the roller skating rink there. There were lots of fun with this because the kiddos really enjoyed skating, gave us a hot minute to maybe give 10 to 15 minutes of education to adults while kiddos were playing, and then tried to encourage everybody to get some physical movement out on the dance floor as well. Lots of different nutrition things too, but focusing in on physical activity, everything from yoga nights to Zumba nights, just lots of really fun things that invite the community in. It was all free of charge to the participants that were participating, and most of this was grant funded. We had a community health worker who was really running this program. With that, I'm going to turn it over to Darian, who's been with us about 2 years now, and the second person to hold the role to talk a little bit more about some of the other programs that we've done through this partnership.
Absolutely. Thank you, Kristin. And good afternoon, everybody. It's an honor to be here. And it's very much a privilege to be in this role that's so unique. Being from a healthcare system and collaborating so closely with the Boys and Girls Club of Kansas City, which happens to be one of the largest youth serving organizations in Kansas City. And so I'm kind of rewinding a little bit. The Sports Lab is a very specific extension of the Boys and Girls Club Healthy Lifestyle programming that we're specifically supporting. And so what that really is just a title for all of our different sports leagues and activities related to sports. And so if you'll click a couple of times on the slide, there's a couple of numbers that'll pop up here for us. There it is. Thank you. And so with these three leagues alone, baseball, softball, flag football, and basketball, we had well over 2,000 kids participating in our leagues this year. And so understanding that, in our society today, there's really one thing that brings people together from all different walks of life, right? It's not politics, it's sports. And so knowing that we have so many kids involved with our programs, that means you have parents coming out, you have grandparents coming out, aunties, cousins, the whole nine. And so one thing we try and do, in addition to the Sports Lab programming, where we use sports as the vehicle to drive home these various lifestyle, behavior, and attitude character qualities and experiences, is also capitalize on that captive audience that we have when we have people within our buildings. And so I won't go too deep into this, but we've done things in the past where if we have a basketball weekend where we have, 500 to 600 different people within our building, we'll have heart screenings on deck. We'll have dental screenings. We'll have various things that make these valuable resources much more convenient and accessible to the community that we're trying to serve. Next slide, please. And so these next couple of slides, I'll just briefly touch on some of the opportunities that I've been able to bring into our club kids, starting with the Nike Sports Camp. And so early on in my role, I was fortunate to connect with the organizer of the first annual Nike Sports Camp in Kansas City, which really consists of a week-long camp where we have some of the best coaches and trainers in the Kansas City area, really just going through and teaching kids the nuts and bolts of football and really helping them develop their bag in a sense. And this is a $500 camp per participant, which, for most folks, I know if I was a parent, I probably wouldn't be paying that. But $500 per kid, and I was fortunate enough to connect with the right people and to advocate for our club kids. And over the past 2 summers, we've scholarshiped well over 30 kids to participate in this exclusive event. And it's been an absolute hit. And on the other side, we have the Summer Jam Classic, which is something that I put together in 2023. And it's nothing groundbreaking, right? It's a summer intra-club basketball league for club kids only. And so really the intention behind this, it came from early on in my role when I was touring my first club, our Thornberry unit, which is the original Boys and Girls Club in Kansas City. I walked into the entryway and I saw this massive display case full of different trophies and medals and pictures from, 20, 30 years back of track teams and swim teams and gymnastics. And it made me think just, how important and how valuable those experiences and that sense of community is, right? We have some colleagues in our St. Luke's team who were club kids at themselves growing up, who will tell stories about their experience, playing basketball or doing different things within the clubs. And so I thought to myself, how can we get back to building that sense of community, that sense of belonging where I want to go and represent my club, my neighborhood, and go compete against, the other side of town. And so that's where this came from. In addition to that, it was as simple as I'm sure a lot of you have kids, have been around kids, and it's really difficult to entertain and keep a group of 12 to 13-year-old boys, tame for 8 hours a day when we have them in the summer. And so knowing that the boys want to play basketball, knowing that we needed to get back to building that sense of community, the Summer Jam Classic was born. And I'm not sure the videos will play. So on the next slide, I have a video for you. If that'll play, I'm not sure. Let's see. So the audio is not going, but this is a clip from one of our pre-game rallies at the Wagner unit where kids are sitting there stomping the chairs, cheering out Wagner, Wagner, just really illustrating that sense of community that came from it. And how I think the coolest thing from this summer, this simple basketball league, was how it grew so organically. And so on this next slide, you'll see we had kids, we intended to have basketball games going on, and we had kids who developed their own cheer teams and dance teams, and we had full-blown halftime performances. So what originally was going to be, 22 kids from 2 different clubs playing a basketball game turned into a much more immersive, robust experience, including dance teams and halftime shows and things of that nature. And the other great thing about this is that this also opens the door for some career exploration pieces around sports where kids, if I'm not playing the game, if I'm not cheering, maybe I can be doing photography, maybe I can be working on journalism, so things of that nature. And so this was really an absolute hit, and we're looking forward to building this and developing it in the years to come. Next slide, please. And then one more program I wanted to touch on was in partnership with the American Diabetes Association. And so it's called Project Power. And really what this is a easy plug and play substitute for typical PE time. So instead of having kids cut them loose and having them run around the gym and just do whatever they want to do, this is a more structured approach where every day there's a brief nutrition or physical activity educational piece followed up by a game. And this was so great because Project Power, they provide the curriculum, they provided materials, they provided a bunch of swag and gear for kids who participated. And then the best part too is that there's a stipend included. So depending on how many kids we had participate within the program, we would get some kickback from that. And then along with that, next slide, please, there is a pre and a post test that all the kids would participate in. And so from 2024, these are the two big things that stuck out to me. And so on the top left, you see baseline versus the follow-up. We have much more kids understanding that water is the healthiest drinking option for you. And that we went from 8% thinking pop was okay to now nobody believes that pop is a good option and more kids are believing in water. And then the bottom right, just showing the collective understanding and growth and awareness that we need to be getting at least an hour of physical activity every day. And so Project Power has been an absolute hit. Again, it's an easy plug and play. It's a seamless transition and something that we had no problem integrating into the normal day-to-day at Boys and Girls Club. And my final slide. And so my real takeaways from my role being that it's so community facing and being so immersed within it is that transportation awareness and accessibility are the three biggest barriers to folks, taking advantage of various resources. Transportation obviously is just getting there. Awareness is knowing it exists or really understanding why I should be taking advantage of this resource. And then accessibility just is this convenient? Is it worth my time to put this effort in to go and get to whatever this resource is? And so my take on approaching that is go ahead and click through this a few times for me. Yep, keep going. And two more. There it is, guys. Oh, one too many. So my approach is this, okay? One is to communicate. And what I mean by that is talking with the people that we're trying to serve, okay? I'm not from the Kansas City community, but just because I'm not from that community doesn't mean I can't be of that community. So what can I learn about the people I'm trying to serve? What do they have an interest in? And where can I fill in those gaps? Number two is align. And so for me, that's knowing who's already doing the work and knowing who cares about what I care about. That way we can, fill in the gaps in a sense. And the last part is just collaborating. I've done some work in nonprofit for some time now, and I've found that there are always so many great people doing phenomenal work, but it often seems to me that the impact is minimized because there's not as much collaboration taking place as what maybe makes sense to do. And so I always tell people I'm not one to reinvent the wheel. And so collaborating and knowing what's out there and knowing what's at stake and knowing how we align and then filling in those gaps is really the approach that we take. And ultimately, it's recognizing that these are the biggest barriers. It's not about pointing the community in the direction of the resources, but really bringing the resources into the community, making it as convenient and as accessible as possible. And so with that, I'll pass it back to Kristin.
Yeah, so just wrapping up here, this isn't anything that everybody on this call isn't well aware of, but if you haven't looked at the Robert Wood Johnson Foundation website, they have one of these little maps for almost every metropolitan area. And we know that life expectancy is not the same by zip code. And so in Kansas City, we actually have up to an 18-year gap from one region of the city to another. And so really being intentional about the community that we're serving, the populations of focus, how can we really bring in programming to places like Darian said, where the community already are, and help with that. And we see our role right in this second picture on the right here. Downstream is healthcare, where we're just pulling the fish out of the water, right? These people with diabetes that are suffering, and we're trying to support them with care, which is really important. But if we want to move upstream, it's about identifying those social needs that are related to these problems, and even further upstream, how are we partnering with all those collaborators in our community to really address the structural problems that are causing these folks to fall in the first place. And so I think it's been a great experience to work with the Boys and Girls Club as a health system, and maybe an opportunity in other cities as well. So we'll turn it over to the next speaker. Thanks for having us.
Thank you all so much from the St. Luke's team. Very inspiring work. Lots of positive comments going in the chat. Next up, we have Miss Adhana McCarthy. Thank you so much for being here, and we really look forward to hearing what you have to share.
Thank you so much. It's always a pleasure to be able to share the messaging of GirlTrek and share some of the work that we're doing. So I appreciate the American College of Lifestyle Medicine for welcoming me. You can go to the next slide, please. So GirlTrek, for those of you who are unfamiliar with GirlTrek, it was founded in 2012 with the mission of rallying 1 million Black women to walk for better health. And that organization reached that mission in 2020. And so now today GirlTrek is on a bold mission to increase life expectancy for 700 million Black women worldwide by 10 years in 10 years. Why do we do that? It's because Black women die at a higher rate than any other group of women in the US from preventable diseases. And the stress of being Black in America is a challenge. Systemic race and gender-based oppression, they create structural inequalities that adversely affect the Black women's health. So the life expectancy of an average Black woman in America is 78 years old, which is about a decade before an Asian woman in America and 5 years before white women. And globally, the life expectancy for Black women is 64. And we identified 3 things as causing the early life expectancy: inactivity, isolation, and injustice. We'll go to the next slide, please. And so GirlTrek looked at the problem. The founders looked at the problem. 137 Black women die each day from heart disease. So that's about half of 737 dying every single day from heart disease. And most of them don't get enough leisure time per day. And if you were to look at those Black women that were born in 2000, half of them will develop type 2 diabetes if the current diet and physical activity levels continue. So this is a problem, right? We know that, lots of billion-dollar weight loss companies and public health campaigns have offered solutions for the obesity crisis facing America, but those solutions are not really targeted towards Black women. And where they have failed in acknowledging the systemic racism and things that affect a term that has been talked about, the weathering of Black women, which is the overall erosion of wellness in all the different environments in which they operate, as being an unhealthy thing. And so by providing a holistic and culturally informed approach to solving interconnected public health, racial justice, and environmental crisis affecting Black women today. So that's what we're looking at. We'll go to the next slide, please. And so GirlTrek, you can see in the picture right there, that's actually the Joy Bridge that we do at the end of every walk. We get folks out together. The walks are usually on Superhero Saturdays. It's women coming together wearing blue shirts, and you could earn your shirt by walking for 5 days a week for a week, and then you get, you can go and go onto GirlTrek's website and get a shirt. And so there's all these different incentives that have been built into bridging community around GirlTrek and their mission. So they gather on Superhero Saturdays, they walk for 30 minutes, they close it out with a circle, a Joy Bridge, and we really want to highlight the impact of everybody being able to get out there and walk. If you look at the people in this picture, not everybody is super skinny. They're not, they're working on their health from where they are. And the goal of GirlTrek is to meet women where they are and take them along with community members to the next steps for their health. It really isn't just recreation, it's a lifestyle. And at GirlTrek, we walk for healing, for joy, for fresh air, for quiet time, for celebration, for mood boosting endorphins, and just the sun rays. We walk to connect, to download, to uplift each other's spirits. We walk to worship, and every day we set off on urban adventures and far off treks and magical places, lacing up our boots and opening the door to life's possibilities. So next slide, please. And so we want to say, okay, well, is this impactful? 1.3 million members, and 1 in 14 households in the US has a member of GirlTrek. And so really, when you look at GirlTrek, it's the largest public health organization dedicated to the health of Black women. And so over 60% report losing weight loss on the average of 15 pounds. 90% notice a mood improvement with walking. 56% sustained 5 or more days of walking for a year or more. And 28% talk about being prescribed less medication, and 78% have been inspired to try more fitness activities. So GirlTrek, for a few years, they actually held a retreat out in the Estes Park, Colorado. And when you go out to their GirlTrek retreat, they had Zumba, they had dance, they had African dance, they had double Dutch jump rope. They had all kinds of things, activities to get people engaged, yoga, everything, right? And so in addition to wellness workshops about, the art of taking a luxurious bath, or, connecting with ancestors, or, just dance parties. It was just a way to bring people together on all kinds of different activities that honor the cultural context of the African American woman. Let's go to the next slide. And so it's community-based in a decentralized format. So I talked a little bit about those superhero Saturdays. That's when, anyone can raise their hand and say, I want to be a leader at GirlTrek. They have a little GirlTrek how to start a GirlTrek crew guide. It's like you get somebody, you can start walking on your own. You can be a solo trekker, or you get a friend and now you're a duo trekker, or you can get 3 people, now you have a crew. And so all of those things are just the way to start. And they have, if you look at the bottom, there's Facebook groups. I was a part of GirlTrek in San Diego. So the Facebook groups are the main ways that we organize. There's a website where you can you can register to try to find a group, or you can go onto Facebook and look for GirlTrek in your city and find something nearby. And you just post a group. You just post a walk. We're going to walk at this place at this time for this amount of time. It's going to be a relatively flat place for people to walk. And so people of all walking abilities are able to come in and meet others, to get to know their communities. There have been stories of women doing these treks just in their neighborhoods, and they're finding public health issues or civic issues, like a down light pole. And so they keep walking in the neighborhood, they see the down light pole, they're going to call somebody and call their civic leader and say, hey, there's something happening in our community. So when we walk in our communities, things happen, things change, right? So Superhero Saturdays are the group walks. You organize them on Facebook, you say, I want to do it. You follow the rules about how to set things up, the best practices, and then you go out and walk. But then during the week, you also have the opportunity to walk, just put on your shoes and go and get your mood better. There was a series of podcasts, Black History Boot Camp, that happened in 2020. And during that, they had several series of 30-minute talks where they would accompany the walkers as they're walking around in their neighborhoods. And so all they had to do was dial into the Zoom, go on their walk, and listen to an inspiring message while they're walking. So those things are all possibilities. And so one of the leaders of GirlTrek lives in Ghana now. The other one lives in Seattle. So it's completely decentralized. It's you step up, you represent responsibly, and then you grow and change yourself and your communities. And that's the power of GirlTrek. We'll go on to the next slide, please. So really, the next challenge is longevity, right? We've gotten the awareness of over 1 million women that, yes, it's time to start walking for health and joy and everything. Now, let's talk about the longevity. Like, how can we address the decade discrepancy of Black women's lives? How frequently people are obese, or what the prevalence is of obesity, of cardiac disease, of the propensity to develop type 2 diabetes. And we'll go on to the next slide, please. And so 7 years of physical movement at sustained levels, plus 3 years of healthy lifestyle habits equals 10 years of life expectancy unlocked. And so that's the way that we're proposing that we make the difference in the lives of these Black women. 7 years of physical movement at sustained levels. GirlTrek has been around since 2012, and now it's 2024. So as we continue, as people who have started with GirlTrek back in 2012 are still with us. And people that have picked up along the way are still out there walking in community. So once you're in that space and you start learning more about eating healthy, you start learning about food justice, you start learning about community gardens, you start learning about how to eliminate toxins from your household. You start to build in the infrastructure needed at the individual level and then also at the community level. You can start writing letters about the incinerator in your neighborhood or the other environmental hazards, the audio pollution because you have a train going by your house 20 times a day, all of the things that contribute to a decreased quality of life and a decreased duration of life, our GirlTrek members can address. So we'll go to the next slide, please. So this is the joy and justice agenda. So this is a part of that plan to get to the 10 years of extended life expectancy in the next 10 years. And number 1 is preventing chronic disease. 2 is to strive for food sovereignty, experience mental health and belonging, practice economic freedom, protect the environment and Black land, preserve Black history, culture, and families, and increase civil engagement. So if you look at these tenets, there are a lot of threads that you've already heard from many of the other speakers in terms of outdoor Afro and their civic engagement, or if you start talking about food sovereignty or mental health and belonging with the St. Luke's programs. We know what makes things happen, what shifts things. And as lifestyle medicine practitioners, it's important that we use the appropriate cultural context for the populations that we're serving to ensure that it really does penetrate the heart, soul, and the mission and the purpose of folks as they decide to move forward. And the next slide. So this is that, at the end of our Joy Bridge, everybody put their hands in, acknowledge each other, and move out. So in that spirit, I want to say that I want to inspire everyone else to move out and do great things in your communities. Thank you so much for the time.
Absolutely incredible. I think each of you has told such a compelling story in terms of what these sorts of community-based programs can look like. And I love that each of you really has a very different niche demographic and, point in the lifespan that you're working with to really build that sense of community and love of movement and so much more. So we have quite a few questions that have come through the chat, and a few that we also wanted to make sure we're elevating as well. So first and foremost, one of the things that really bubbled up just from hearing each of you all share your work is the power of community. And I'm very curious around how you all are seeing, the benefits of community building as an extension of your work beyond the opportunity for physical activity. And I think it sounds like there are multiple layers here at play. So I'd love to open that up to the panelists.
I can start. I can say that community, these community programs have actually been a lifeline for me. I'm in the military. I've been in the military for 20 years. And so there are communities that I can tap into because I'm in the military. But as I'm learning about the civilian environments that surround the military base, these communities are actually the ways for me to find an entry point and to find connections and to find a way to feel like I can be a part of something bigger than just where I am at the base. And so that's one thing that on the individual level that I see as a critical component of community. On a grander scale, I think that when people are seen in a circle when they start and are seen in a circle when they're closing is a critical thing to bring everybody into the same space and say that we are collectively moving forward with something. That's all.
And I think very similar in Outdoor Afro, we've seen community. Community is sort of it's a in and of itself a removal of a barrier, because if you don't feel safe in a space, if you don't feel empowered or capable in a space, just because you don't know your way around it, you're not likely to venture out. The other piece is that community creates, just as she was just saying for GirlTrek, belonging, right? Just knowing that I belong here. These people see me, they see us, and the power within us. And it isn't about others coming in and, creating interventions. And that makes it so that on those days when I want to just stay indoors and deal with the challenges of the day, I'm more likely to get out because my community is out. And, those are pieces that as we think about things where we lock arms with healthcare practitioners, how will you engage community, or how will you encourage folks to connect with community so that they have support on that journey, people who are on the journey, in parallel or, together every day waiting on the stoop for you to go out for that walk.
Yeah, and I'll add too within our roles, so obviously with the Boys and Girls Club, we're focusing more on youth, right? So that's anywhere from kindergarten up to teens. And so we have so many different programs and initiatives centered around physical activity and nutrition for our kids, and it's amazing, right? We're seeing kids kind of have those light bulb moments and make different, have different behaviors and make different decisions. Now, the thing that we're really trying to lean into developing more of is what can we now add for the parents and their caregivers so that they're on this collective journey together. Right. So it's great you can come to the club and, and try different foods and have this activity, this programming. But what does that look like when you go home? We don't want that to stop once you leave our doors. And so that's something we're leaning deeper into is, how do we complete that circle and provide that full holistic opportunity for the families that we're serving?
Wonderful. Thank you all so much for those thoughtful responses. Another topic that has come up in multiple questions in one way or another is around the concept of funding and sustainability. How are you all doing this work? How are you all setting yourselves up to continue doing the work? And I think it's important, I know, just thinking about the Reach-In program and just the incredible work with the sports leagues, and sports we know are very expensive. And one of the programs that I helped to run here in DC, it's a produce prescription program, but we're always looking at other things to add. And we've gotten a lot of feedback from families. We can't get our kids into sports teams. It's just cost prohibitive. So I would love to hear actually from each of you all around how you negotiate your budget and funding, and making sure you're setting things up to not just be like short term, but setting things up for the longer term when possible. So let's maybe start out with the Outdoor Afro team. Miss Dee.
So for us, it's, I think someone in the chat mentioned, hey, that sounds expensive. And, it is expensive. A lot of the activities that the community seeks access to, it is hard to get started if you've got to buy gear, if you've got to pay to get into a venue. And so one of the things that our program is, a lot of it is to pay for, to cover those costs, or to negotiate partnerships with venues, partnerships with gear and equipment providers, so that we can offer free or low cost access. And we try to navigate those relationships such that we can have long-term access. They don't have to go out with us. We're asking for, but what's the code? What's the link that they can follow? What's the place or who's the contact that the community can have when they come alone, when they come with their friends and they're not with an Outdoor Afro volunteer? And that's meant getting very creative with our partners who are foundations, but also corporate sponsors, right? You kind of have to have a really diversified mix. And also, I think it was Darian who talked about alignment. There's a different context for this alignment, but making sure that you're finding funders, sponsors, and partners who are aligned with the mission of bringing benefit to a community that they serve as well. A community of customers, a community that just shares a location with them, where their business is located, and then also that they share our ultimate mission of improving the health and lives and creating joy in the lives of the folks that we collectively serve.
We can hear from maybe our St. Luke's team.
Sure, I can start, and Darian, feel free to chime in. I think one of the things we've done to try and make this sustainable is Darian's position. So I think that's a little bit of a unique way to approach this. And I think it was UDD that said, you know, you don't want to just come into a space and provide programming, right? And so really having somebody that we're funding the position, but Darian really is in the clubs on a regular basis. The club kids know them. And so funding it through community benefit dollars, I think is one way that, you know, Darian's not pulled into the day-to-day staffing of what it takes to run the clubs. And then so sometimes these programs go away if you're reliant on somebody who also has duties to just do base operations. And then if you're below, you know, the minimum staff for the day, or you've got call-ins or whatever else life throws at us, then you can't meet some of these other higher level things. And so having Darian there, but really dedicated to elevating some of these programs and making them a priority, I think helps give this a sustainable approach. And then all the other programming components that you saw, it's just such a variety of different foundations and grants, and really trying to diversify, like you said, what we can do and who else is in this space. As Darian said, well, also there's so many dots that we can connect, that people are already passionate about work in a similar space, and we don't need to reinvent that wheel. Let's just collaborate, and then it's cheaper too, because we're economies of scale, and we just, you know, just partner up. So that's a couple of my thoughts.
Kristin, you took the words right out of my mouth in terms of collaboration. I think that when you are presented with things like Outdoor Afro or GirlTrek, things where they have an infrastructure, they have a core level of staff that they fund through grants and partnerships and sponsorships, like REI has done sponsorships, Columbia has done sponsorships for GirlTrek and whatnot. There's an infrastructure in place. Why not step into those spaces and hold up your hand and say, I'll organize a group in my area on behalf of your organization, right? As opposed to, you know, doing all of the legwork to create something that's exactly your own, and you haven't really fully fleshed out all the details. So as I am always about collaboration, because that's one way to amplify whatever is happening. Just one little story: when I was in PA school, like over a decade ago, I started to help out community gardens. I am a community gardener. And instead of starting my own community garden, because I knew I was only going to be there for a year and a half before I went to clinicals, I just created a meetup group. And I started to support all the different community gardens in San Antonio. So that Facebook group is still out there. People are still connected. People are still sharing advice about community gardens. But that's the type of thing. You can find an existing infrastructure almost anywhere where you are and step into it and say, how can I help?
Wonderful. Thank you all so much. We have quite a few wonderful and deep thinking questions in the chat. So I think I'm going to go with the one that just came in. What type of social and behavior change science have you used or recommend using to inform the design and implementation of a lifestyle program like yours? So thinking about identifying barriers to exercise that need to be tackled, or how do we capture the various stigmas that folks might hold around exercise? So how are we framing the work, and how are we drawing upon evidence and behavior change science to build interventions or programs that are higher likelihood of being effective? We can maybe start with, everyone doesn't necessarily have to answer this. Does anyone have a compelling thought around this question? I thought it was a quite good one. Using the evidence to inform our interventions.
I would just say, yeah, using evidence to inform. We did some community listening sessions to hear from the community too before we got started. Making sure, as we've been talking about from a collaboration perspective, that we don't start something new where there's already robust infrastructure in place that we can join. And then looking at some programming, right? There's some evidence-based programming that we can implement. And so instead of creating our own homegrown whatever we might think, the ADA program, the Project Power that Darian presented is another good example of that, where there's curriculum available, and we don't have to figure that out ourselves. We can tap into that, and in those cases, that both helped from that perspective and on the sustainability side as well, because that curriculum exists. It's easy to train and keep that multiple people in that training. And then they even offer a stipend back. So instead of money that we're spending to develop a curriculum, they're actually providing money back to the clubs if we deliver the curriculum. So that's another example.
Wonderful. Thank you all so much. And, thinking about the healthcare system in general, and how we can embed these various programs and also utilize the healthcare system in benefit of various community benefits like physical activity or gyms or produce prescription programs. Have you all seen any glimmers of hope around getting financial support from different health insurers to help to underwrite programs such as yours? And this can be open to that panel, kind of into that sense of collaboration with the health insurers and making the case for these sorts of programs.
So my background, actually, I spent the last probably like 12 years in healthcare before joining Outdoor Afro, and I was leading population health, community health, and health equity programs for large health insurance companies. And we, my team spent a lot of time building out, food as medicine, housing as medicine, and working with lifestyle medicine healthcare practitioners to try and make the case. And I'm just going to be real. It was very difficult, right, to create we will cover this with health insurance in the ways that we will cover a prescription medication. They were great for pilots. They were great for an expansion of the pilot, but scale, right, was the challenge that I think most of us are probably still wrangling with, right? And I think part of it is just it's yes, cheaper to get out and walk than it is to stay on a medication, but also hard to manage adherence. Docs didn't want to be watching everyone's 10,000 steps and watching all those data streams come through, and weren't really sure how to translate a lot of that into recommendations, into protocols that determine what the next steps were. So it's more challenging than one might imagine, even though I think it's probably really accepted amongst, all practitioners, right? That if folks could just have a healthier lifestyle, they'd see them less for more severe things, and they'd have to medicate everyone less. And then life, right? We can't get out. We work too much. We don't have the dollars to do it. We don't live in spaces that are conducive to getting out as often as we might. All these things happen. And so what I will say about where that ultimately leaves us is we keep trying, right? We keep finding these hopeful spots and spaces where the health insurance companies are, as Kristin was talking about, they do have community benefit, right? I worked for Kaiser, worked for Shield. They have community benefit dollars that they also grant to organizations. And so in a lot of cases, you're being funded there. There also has been a movement around a focus on social determinants of health. And that has created some opportunity for funding and for collaboration with, health systems and with health insurers. And so I think making the case with your program that you are creating large scale impact in a community that they serve minimally gets you on the list for getting a grant, minimally gets you on when we are convening the folks who we believe can move the needle and whom we want to resource, gets you in the door there. And I think maximally, though, what you hope is that together we all create a body of evidence, right, that will connect to, the holy grail in healthcare, which is healthcare cost savings. Sorry, that's not as sexy as health equity being the holy grail, but we still will work on that. But I think if you can get there and show how overall you're bringing down the cost of keeping people healthy, and you're doing it with things that are long-term sustainable, I think we'll have something to work with. So back to that old trope now of let's just band together and create the body of evidence that then creates the sustainable funding.
All roads lead back to collaboration and pooling resources, pooling data. I think that's where definitely the future of success lies. Well, thank you all. We've come to the top of our hour, bottom of the hour, top of the next hour. And I did want to just wrap things up very briefly. If we can take maybe 10, 15 seconds parting words from you all, and then I'll just wrap up with a few brief announcements. But just any high level recommendations, let's say you're talking to us as the lifestyle medicine clinician community, what advice would you give them if they're listening to this? Like, what's next? How can I get into learning more about the programs in my community? Like, what advice would you give? We can do like a rapid round robin, maybe starting with Adhana.
My advice is to be with the lead and understand where you are and who you're working with.
You said be with the, I'm sorry, I missed the first.
Be with the lead. So be with the people that you are leading. So if you're a community member in your community, be out there and put yourself out there so that you can understand what's happening in your community. Over.
Thank you. Great advice. Our St. Luke's team.
That's pretty much what I was going to say as well. Just hit the streets. You don't have to be from the community, but you can definitely be of the community. So get out there, talk with people, and just be involved and be immersed. That'd be my advice.
Thank you.
Similar advice for me, get out there, join the communities. But I would add also that if you are a clinician or a healthcare provider, you are probably closer to resources. And so when you're getting out in community, it should be not just to teach, but to learn. What does the community need? What does the community want? What is the community already doing? And then to look toward the organizations that you represent or the organizations that you're a part of, and how can you point those resources at the things the community is already doing or that others in the community are already leading.
Incredible. Thank you all so much. Genuinely, this has been such a rich conversation. Like your unique backgrounds have definitely folded in nicely to a wonderful conversation. So thank you all so much for being here. Thank you all to our audience members, and also to ACLM for providing a platform for us to have this conversation today. And I wanted to share a couple of very brief reminders. If you're not already, we encourage you to come on and join us here at the American College of Lifestyle Medicine. I invite you to definitely come on board the HEAL Initiative. We're meeting every other month. And one of the things we do is events such as this today. We also have a deadline coming up for the LM25 conference. And so if you have an idea that you've been percolating on, we encourage you to submit a workshop proposal on health equity and lifestyle medicine. And that deadline is January 3rd. And lastly, a quick plug, we have a scholarship program through the HEAL Initiative for underrepresented clinicians who are looking for some assistance to get through the training, get certified in lifestyle medicine. And so please be on the lookout for the application, which will go online in January 2025. So next slide, please. Couple of quick save the dates. We'll be wrapping up our 3-part webinar series top of next year, and we will be doing this in collaboration. So stay tuned for more details there. And our next HEAL Initiative meeting will be in February of 2025. Next slide. And just a quick last little plug, if you haven't already done the Food is Medicine Essentials course, you can scan the QR code here. It's fantastic. It's free CME. And if you'd like to learn more about HEAL, we invite you to scan that QR code and hop over to our site to learn more about what we're doing. So thank you again so much for being here. Thank you to our panelists, and we'll see you at the next webinar.